Hello medical students, welcome to my YouTube channel. In this video, I have uploaded a document recently released by the National Medical Commission, that is frequently asked questions on NMC CRMI Compulsory Rotating Medical Internship Regulations 2021. We will see the frequently asked questions one by one. When did the CRMI Regulations 21 come into force? CRMI Regulations 21 came into force on the date of their final publication in the Official Gazette of India, that is on 18/11/21. To whom do CRMI Regulations 21 apply? CRMI Regulations 21 are applicable to all medical graduates. This is very important, to all medical graduates, either Indian or foreign medical graduates, who begin their internship on or after the date of publication in the Official Gazette of India 18/11/21 and wish to obtain permanent registration to practice medicine in India. Is it mandatory to do CRMI? Yes. All medical graduates have to undergo compulsory rotating medical internship in India to be eligible for permanent registration to practice medicine in India. Where can internships be done? Internships for Indian foreign medical graduates can only be done from a medical college or institution approved, recognized by the Commission and listed by the Undergraduate Medical Education Board under the provisions of Section 35 of the Act. Next question. Who is responsible for implementation of CRMI Regulation 21? The Dean, Principal, Director or any other equivalent authority. What is the prescribed duration of the internship? Minimum period of 12 months to the satisfaction of the college authorities and the university concerned after passing the final MBBS examination or National Exit Examination for MBBS next, so as to be eligible for the award of the MBBS degree by the respective universities. Are there any time restrictions for completion of CRMI? The internship shall be completed within 2 years of passing the final MBBS or foreign medical graduate examination, FMGE or next step examination, whenever in force. Are there any exemptions from the time restriction for completion of CRMI? The minimum duration 12 months may be extended appropriately by a reasonable period on recommendation by the college or university for reasons including but not limited to insufficient period of attendance or any exigency such as disasters or unforeseen circumstances in the country as notified by the Government of India or any competent authority duly authorized to do so. Are interns allowed to take leave during internship? Yes. The following types of leaves are allowed. Normal leave, a maximum of 15 days leave with prior permission during the entire period of internship. True. Maternity leave, according to prevailing rules and regulations of the central government or state government. Paternity leave, 2 weeks either in continuation or in intervals of 1 week each within 1 year of internship. Medical leave included within 15 days of normal leave. See, this is the types of leave available for interns. Are interns allowed to transfer during internship? No. All Indian medical graduates shall complete their entire period of compulsory rotating internship training in the institution where they have pursued and completed their MBBS. What are the eligibility criteria for completion of CRMI by Indian medical graduates? Successful completion of MBBS course of any university from a college or institution approved and recognized by the Commission and listed by the Undergraduate Medical Education Board under the provisions of Section 35 of the NMC Act. The qualifying examination in accordance with the applicable rules and regulations of the Commission at the time of commencement of internship. The final MBBS examination, the National Exit Test Step 1, whenever this examination becomes operational, any other requirement as may be regulated or notified by the central government. All Indian medical graduates shall complete their entire period of CRMI in the institution where they have pursued and completed their MBBS. See that all medical students should complete their internship only at the medical college where they have pursued. In accordance with the rules regulation, the Maharashtra University of Health Sciences has issued that as per NMC norms on internship guidelines, externship, where students can do their internship in hospitals attached to medical colleges other than the institute they have enrolled in for MBBS course, is not allowed anymore. This is the compliance of the regulation by the Maharashtra University of Health Sciences. 1 year approved service in the Armed Forces Medical Services after passing the final MBBS examination shall be considered as equivalent to the pre-registration training detailed above, and such training shall as far as possible be at the base of general hospital. The training in community medicine should fulfill the norms of NMC as proposed above. However, next step 2 will be mandatory for these candidates also. What are the eligibility criteria for completion of CRMI by foreign medical graduates? This is important. Already I have given such information in my previous video. However, I once again, a foreign medical graduate as regulated by the NMC Foreign Medical Graduate Licentiate Regulation 21 are required to undergo internship at par with the Indian medical graduates if they desire to seek permanent registration to practice medicine in India. Any foreign medical graduates, if they are desirous of seeking permanent registration in India, it is mandatory to undergo internship. All foreign medical graduates, unless otherwise notified, shall be required to undergo CRMI at par with the Indian medical graduates after the National Exit Test Step 1 after next becomes operational. Indian citizens, including overseas citizens who are foreign medical graduates who do not fall under the purview of the NMC Foreign Medical Graduate Licentiate Regulations 21, shall be regulated by the provisions of subsection 3 of section 13 of the IMC Act 56 in accordance with the advisory issued on 2nd September 20 and shall be required to complete CRMI in India if they have not undergone such practical training after obtaining such qualification as may be required by the rules and regulations in force in the country granting such qualification or has not undergone any practical training in that country. Foreign medical graduates who require to complete a period of internship shall do so only in medical colleges or institutions approved for providing CRMI to Indian medical graduates. 1. FMGs may be posted first in colleges which have been newly opened and have yet to be recognized. May be posted to different medical colleges or institutions through a counseling or seat allocation process based on the merit. Thirdly, medical colleges or institutions may allow up to 7.5% of their permitted quota. This is the upper limit for allowing FMGs. The college or institution and its affiliated hospital and community health center shall be recognized by the Commission for conducting the CRMI regulation. Finally, who is a mentor? A mentor is an appropriately qualified and trained medical teacher and senior to the trainee who guides the trainee in all aspects of graduation such as education, skill, enhancement, research work, and ethical values. The entire course of internship is to be done under active supervision of the mentor duly qualified in that respect. What should be the qualifications of a mentor? A mentor for interns shall possess a postgraduate qualification in the subject concerned and shall be duly certified as a mentor for interns by professor and head of the department concerned. This is the last question. What is the amount of stipend to be paid to interns? This is the most expected one. All interns shall be paid stipend as fixed by the appropriate authority applicable to the institution, university or state. The total stipend paid for the entire internship may be for 52 weeks, that is 12 months only. See, this is the fact sheet. 1. Applicable for interns commencing internship on or after 18/11/21 to be completed within 2 years of passing final MBBS, FMGE, next step 1. And thirdly, there is no transfer during CRMI. Normal leave 15 days, maternity leave as applicable in state, paternity leave 2 weeks, medical leave included within 15 days of normal leave. Thank you.